ARD stands for asbestos-related disease and usually involves the lining of the lungs in regard to the particular type of asbestos that was here in Libby. If I had ARD, there would certainly be things I would expect to do in regards to changing my lifestyle that might make it easier for me in the future. The first thing I would want to do is build up the stamina in the muscles I actually use to breathe with. You just can't do that sitting on the couch. We recommend a mild to moderate cardiovascular exercise program, things like walking or stationary bicycle, treadmill. Doesn't have to be sweaty, but it should be 20 minutes of sustained rhythmic movement 3 days a week. So for people who are physically unable to exercise, we want to design or incorporate some activity that allows us to more fully expand our lungs in a rhythmic pattern, such as singing or reading out loud, or even playing a musical wind instrument would tend to be beneficial. Other things that are obviously beneficial if you have asbestos-related disease would be to limit unnecessary irritants, such as smoking or participating in activities in dusty conditions without proper personal protective equipment. Any additional irritation would create more mucus secretions and coughing, which would be counterproductive to your quality of life. Simply avoiding socializing with people who are obviously ill. Any insult to your own health, such as colds and bronchitises and things like that, would further irritate the lining of your lung. Also, eating healthy and avoiding becoming overweight is notoriously beneficial, simply because the additional weight would be an unnecessary burden on your respiratory system. Obesity is what's called a comorbidity, which means that it's an additional illness that aggravates all other illnesses. If you do get sick with a respiratory illness, we do advise more early interventions for our diagnosed patients with asbestos-related disease. The old adage of waiting 5 days before going to the doctor to see if you get better just doesn't seem to be beneficial in our true asbestos-related patients.